Welcome to learning more about BabyLase. BabyLase is a non-invasive, gentle, and nurturing procedure using the healing potential of light to address many of the problems faced by our littlest and most vulnerable of patients, which are aged 0 to 2. The procedure usually takes about 15 to 20 minutes, and the benefits can range from 3 days to a lifetime of the potential of improved health and wellness. Even though babies cannot tell us how they are feeling during and after treatment sessions, they are able to show us. After the treatment is complete, babies are relaxed, calm, and often have immediate improvements in feeding, sleep quality, and emotional regulation. BabyLase was created after years of experience providing safe and effective Oralase therapy for adults and children. Based on the extensive experience with using Oralase therapy as developed by Dr. Derek Nordstrom, Dr. Angie Tinholder further refined the process to address the needs of babies who possess similar but much smaller bodies, as well as significantly different neurological patterns than their older and more developed friends and families. BabyLase providers are trained in understanding the role of neonatal development, as well as the neurological and functional differences between babies, children, and adults as they apply their knowledge and clinical skills for their patients. Our brains and bodies are forming during the first 1,000 days of life, and interruptions to those developmental processes create patterns of dysfunction that can endure throughout childhood and into the complex life of the adult with chronic conditions associated with emotional and physical suffering. And the most important aspect of understanding why BabyLase is effective is in taking a deep dive into the specific needs and challenges of babies. Nature provides us with the gifts of overcoming those obstacles of interruptions in development as a result of trauma through the nurturing and supportive acts of feeding, physical touch, and suckling. However, not all babies are blessed with a combination of genetic resilience and an environment that provides for their unmet needs. BabyLase is designed to recreate familiar, comfortable sensations that allow the brain and body to integrate the healing sensations of therapy to adapt and overcome the challenges of a less than ideal situation. It also creates the proper amount of warmth to release restrictions beneath the surface of the skin to improve the muscle and fascia, to reduce discomfort and improve muscular function of the face, mouth, lips, tongue, and neck. This gentle, reversible therapy offers the benefits of massage without the pressure usually needed to release the painful restrictions caused by muscular discomfort. It also offers an opportunity to reset the stress response and gently remove the invisible yet influential restrictions beneath the skin and within the brains of these little ones. An analogy that people can understand is what BabyLase does is like taking off the brakes of tissue restrictions while turning on the lights of improved neurological function to create immediate improvements in function and comfort. Basically, we're releasing restrictions and improving neurological connection speed. It's not uncommon that new mothers who want to breastfeed their babies encounter difficulties in this journey in feeding their newborns. However, feeding challenges with babies are not limited to the breastfeeding diet of mother and child. Babies often have feeding challenges that include gagging, spitting up, gassy, painful bellies, frequent feedings, and many other conditions. Many hope for a quick and easy solution to the complex problem of feeding challenges, and they hear about opportunities created by surgical and lip tie releases. In recent past, there's been a dramatic increase in the number of babies receiving surgical treatment known as tongue tie releases, commonly with the use of a laser that cauterizes or evaporates a piece of tissue that is sometimes identified as a restriction, when it is often a normal piece of tissue surrounded by abnormally functioning tissues. The Academy of Breastfeeding Medicine position statement said that we need to be a little bit more cautious when we're going into doing surgical procedures without a full functional evaluation. Because the most expensive liquid in the world is a tear. It's 1% water and 99% feeling. So we should really be thinking about how we're addressing tongue tie restrictions in babies. Articles are published that are highlighting the complications and misdiagnoses associated with infant phenotomy. So the results of this healthcare survey said that there are miscommunications happening within our professional organizations, and we need to work to be better. Even though there are many babies that have benefited from surgical tongue tie releases, there are also many that have either not improved or have gotten worse after this procedure. We might never fully appreciate the potential of the long-term damage of these unwanted consequences of surgical complications. The reality is that babies can't tell us how they feel. They just do whatever they can to survive. But what if we could offer our littles a gentle, non-surgical approach to optimizing their function, as well as to assist in determining if and when a surgical release may be indicated? And that's what BabyLase is all about. Those who have personally witnessed the benefit of treatment have observed that the patients who have received the gentle yet sophisticated sensations created by Oralase and BabyLase, they're encouraged by the immediate and long-term improvements experienced as a result of treatment. There's often an improved latch and comfort during breastfeeding. There's reduced gagging and spitting up as a consequence of a more normalized reflexive response to feeding, as well as a relaxed and well-regulated baby as a result of addressing the effects of gestational and birth trauma. So there are those who haven't witnessed BabyLase and are often curious about how it works and why the results of BabyLase are not easily predicted. Another question revolves around the topic of why there isn't peer-reviewed literature based on expensive and lengthy clinical trials on BabyLase. So we're just going to address those concerns head on. BabyLase is an emerging technique based on many years of safe and effective use using FDA-approved technology by providers all over the world. We do hope that someday soon, those that are trained to do research in an academic setting will help those of us in the clinical world prove to the rest of the world and our patients what we see in our clinical practices and in our patients every day. Until then, please understand that our provider community is comprised of clinicians caring for their patients and educated parents that can make their choice with treatment options for their babies. The CARE release is an acronym for a careful assessment and restriction elimination. By assessing the many neurological and functional restrictions invisible to the naked eye, BabyLase providers are trained to gain optimum results of surgical releases when they are indicated. Most BabyLase providers are aware of the appropriate and sometimes necessary need for a surgical release of tongue ties that are truly restricting oral function. They also know that if a surgical release is actually indicated, that providing BabyLase therapy to complement the assessment and treatment of oral restriction allows for more conservative surgeries with fewer risks and better outcomes. I want to take a moment to explain the drawings to the right. What research has indicated is that by the visual observation of a sublingual frenulum, also known as a tongue tie, what we can see is notated in this red line in this middle diagram. What we can't see is depicted by the green line, which is the fascia that is sometimes upfolding into that mucosal fold and sometimes not. And then there are also times where the muscle fibers are being pulled up into that midline structure, and we cannot discern visibly what kind of tissues are within that fold. The research indicates that if the intersection between the green line and this hashtag area representing the muscle is violated during procedure, another restriction or a scar is formed, which is why it is so important to lay down this area of fascia and release it and relax it prior to doing a surgery so the surgeons can avoid the damage of unnecessary intervention into the muscle layer of the tissue. Because as we're showing with this iceberg picture, what we can see is small. What we can't see may be more impactful. And just as any therapeutic approach, such as diet and exercise or any rehabilitation therapy, involves commitment to the process and awareness of an uncertain outcome, the outcomes of BabyLase should be considered with very similar expectation of results that reflect individual variability based on not only the patient's baseline conditions, but also the level of commitment to care. No one expects that one session at a gym, one workout session, or going to a therapist one time will achieve immediate results of treatment. So why should this expectation be placed on any avenue of comprehensive wellness and healing? The results of treatment with BabyLase are always based on a combination of what the breastfeeding dyad of mother and child and/or in a non-breastfeeding family, the caregivers and their healthcare team can provide for the baby. The results of treatment of BabyLase can be immediate and long-lasting, but they can also be temporary and fading if the root cause of the problem is not able to be addressed during the 24 to 72 hours following each treatment session. Babies cannot talk to tell us what they need, so relying on the nuances of the baby's signs, symptoms, as well as the assessments of a skilled provider team are critical to the success of BabyLase. Our BabyLase community is dedicated to helping our most vulnerable become our most victorious. We understand the obstacles of our realities while embracing the opportunities offered with this procedure based on the application of natural principles supported by the sophistication of modern technology. We might not be able to promise to cure every baby with every treatment, but we can reassure our parents of the patients that the many benefits of safe, conservative, and effective care often outweigh the known as well as unknown risks and consequences of surgical interventions. By offering the many benefits of BabyLase for their patients, our provider community strives to improve the treatment outcomes while committing ourselves to the babies and families who need our help the most. Choosing a well-trained BabyLase provider is critical to the success of the therapy. We want to empower each family in finding the information that they need to make the right decisions for their baby. It's important to us that the BabyLase procedure continues to provide successful results of treatment as a reflection of the commitment of our provider community to the authentic and proper use of the BabyLase technique and the carefully selected FDA-approved technology. Our dedication to educating the public on the level of commitment shown by the members of our provider community is reflected in the commitment of our BabyLase providers to the credentialing process. As science continues to evolve and improve our understanding of ways that we can better serve and improve the lives of our patients, we believe that continued education is a critical part of validating the commitment of the BabyLase provider. So look for the logos when choosing your provider. To support the public in finding a practitioner that best suits the needs of their family, we have created a list of our elite providers who have dedicated themselves to certification, as well as those who have participated in an approved hands-on course instructing on OralLase and BabyLase techniques. The providers listed on the websites with validated training and credentialing are authorized to use the federally protected OralLase and BabyLase trademark and logos. Those lists of the providers are available to the public on the websites www.oralase.com and www.babylase.com. We look forward to improving the lives of our little ones in big ways. To find out more about BabyLase, please visit babylase.com.